we have done extensive work on Puberphonia. Today also we had a talk with the professors of bioengineering department. 4 students has registered their name to do internship in Siva ENT Hospital in Puberphonia. Our aim is to create a big rapport with the bioengineering students in creating a little more awareness on Puberphonia. So this is strongly we are doing. Now we have distributed today 50 boards like that. It should be installed in different hospital, shopping mall. So any boys with Puberphonia voice, they can register and find out the quality of the voice. This is what we are telling already. What we are telling is we have created an app called as Puberphonia Dr.M Kumaresan app. So they will just talk with their cell phone by identifying their voice in the QR code itself. So that will give you a great knowledge to them that their voice is little puberphonic. So they will immediately contact us or the local doctors. Yes, it can be treated like that. Then it will give you a definite idea of treatment for them. So this is the thing we have done and we have distributed. Along that, we are creating an awareness of doing a work on Puberphonia. We have already attached with Kalasalingam University for training Puberphonia. As a city center we have created. So Kalasalingam University we have formed a MOU. Under that MOU, we have created a Chennai city campus where we are going to train in AI and VR, Puberphonia and allied voice disorder research and teaching center we have created in Siva ENT Hospital. So we are going to treat AI, VR, Puberphonia and allied voice disorder research and teaching. That is the center we have created in Siva ENT Hospital. So we have created an AI and VR a research center in Siva ENT Hospital, where we have distributed the application form to various people, and people are willing to join in Siva ENT Hospital and do research on Puberphonia. This is a very big, great opportunity for us, not only for us, for the whole medical fraternity, I can say. So this will definitely create an awareness, not simply awareness, created a great show on earth that they can train themselves. See, this is for MBBS, ENT graduates, definitely. But AI and VR, it can be learned by all medical fraternity people. Because AI for identification of Puberphonia. So globally, Puberphonia boys has to be identified. They themselves should measure their voice and know that their voice is puberphonic. What a great thing. So they can measure themselves the Puberphonia voice. That is the great thing. If they measure their voice, they immediately know that they need treatment. Where to go also, they will have the idea. They will ask the local doctors. Because some of the thing, that doctors, when we reach for this non-organic lesion, they request for wait and watch. So that stigma can be removed. Yes, we can treat it because once they know the Umar treatment, EULA manipulation and training treatment, it is a simple treatment. Try to understand. Puberphonia voice is laryngeal voice. Alargia. We are making it as pharyngeal voice. Hello, how are you? This is the difference between female voice and male voice. Female voice or children voice or puberphonia voice is a laryngeal dominated voice. Alargia. That is mostly produced by the vocal cord. Now we are transforming the voice from larynx to pharynx. Hello, how are you? Happy? So you have to create a pharyngeal voice. There only we are doing EULA manipulation. How EULA manipulation will help means EULA voice or palatal voice or pharyngeal voice is low pitch voice. So this voice, if you are able to create, means definitely we will be able to give you a great support for puberphonia voice. That we are giving the voice, changing the voice. Yes, we have changed the pitch immediately. Hello, Nalargia. Hello, Nalargia. But it has to be maintained. All the maintenance in human being, it is already recorded that it may need 21 days continuous practice. But in our experience, if you give a 5 days, definitely it will become permanent, provided they understand that their problem is cured and they are getting their ancestor voice. Very important, try to note. After treatment, when they give a call to their father, mother, or parents, or some relative or friend, they immediately recognize that their voice is similar to their parents, brother. So once you recognize that our voice is similar to our relatives, inborn blood, then there is no chance for recurrence at all. That is what we are taking 5 days to train them, and they will get a good voice. That's all. So today, Saturday, see, we are so happy. 4th July 2026, we have recorded and treated 1,744 cases of puberphonia. This I can gladly say, this is a great world record and opportunity for us. So many engineering college, biomedical, bioengineering students, their professors, especially Dr. Kumaresan of bioengineering college, see, they are very happy and they want to work with us in puberphonia. They have brought 4 research students who are interested in doing puberphonia research. Internship, they want to do it. So if more bioengineering students had joined with us and doing the treatment, means this research means puberphonia will go globally and we can definitely make a landmark on the treatment of puberphonia. We pray all those who are interested in puberphonia, AI and VR identification, training, all the things. You see, doctors treat it definitely, but identification should be done globally. That is the paramedical staff, even nurses. They should know AI and VR treatment. And physiotherapists, occupational therapists, speech therapists should be involved. Now, luckily, we are having bioengineering students. They want to know about more puberphonia and record their voice and identify the puberphonia by AI. So identification, if you already have some 1,000 voices of puberphonia, so any recorded voice, they will put it in AI and it will say you whether your voice is puberphonia or not. And virtual reality is for training and follow up. Luckily, some of our students are very interested in recording the voice of teachers, politicians, street vendors, those who use their voice professionally. So they are recording their voice and forming an AI to identify the occurrence of problem. It may be a puberphonia voice, it may be a vocal nodule voice, or polyp voice, or contact voice. Then another thing is old age voice problem, singer's voice problem, teacher's voice problem. So all this identification can be done with the AI. That is what the bioengineers had come with us. They want to go do courses with us. And definitely virtual reality will help in further training. In remote training also we are aiming. So if it is successful, we can treat the patient from foreign or faraway places, villages. So our treatment has long way to go and we can achieve a great thing. Thank you very much. We'll see next Saturday also. Today we have finished 1,744 cases. Today is 4th July 2026. Thank you. We meet next Saturday, the same time. Thank you very much.